Well, good afternoon, everyone, and welcome to OBI's Public Talk on Dimensions of Care. My name is Tom Mickelson. I'm the President and Scientific Director of the Ontario Brain Institute, or OBI. So many members of the OBI team, including myself, reside on the traditional territory of the Anishinaabe, the Haudenosaunee, the Wendat, and the Mississaugas of the Credit First Nation. Today, this meeting place is still home to many First Nations, Métis, and Inuit peoples who remain the caregivers of this land. So we're grateful to have this opportunity to live and to work here. The OBI is a provincially funded non-for-profit, and we work to accelerate discovery and innovation with benefits to patients and the economy. So we were founded in 2010, and our vision is to position Ontario as a world leader in brain research, commercialization, and care. And of course, this mission is to improve the lives of the 1 in 3 Canadians impacted by a brain disorder. So the way we do this is through team science, which is a collaborative approach that unites researchers, clinicians, industry, patients, and their caregivers. So together we're discovering and delivering innovative treatments and services that support those living with autism, epilepsy, concussion, dementia, cerebral palsy, and depression, just to name a few. So over the last 8 years, we've hosted more than 25 public talks featuring experts in neuroscience and brain health. The goal of this public talk series is to educate, inform, and empower you with the knowledge about brain health, drawing from the latest advances in research and care. The topics of this year's talks were prioritized by you, our viewers and event attendees. So in response to all this excellent feedback, we aim to share the knowledge, ideas, and resources that can support, again, the 1 in 3 of us impacted by a brain disorder. Perhaps most importantly, though, we'll share the stories of people with lived experience. So today you've joined us for Dimensions of Care, the second of 4 talks in our 2022-23 series called Your Brain Health. Tonight we're going to hear powerful stories of advocacy from individuals who've supported loved ones through their significant health journeys, as well as from those in the community who've taken part in the healthcare system navigation projects, which are designed to help people living with neurologic conditions to access the care they need. We're going to look at different facets of care and explore how each of us can participate in shaping the future of care in our communities. So since its inception, OBI has united the Ontario brain health community by prioritizing this patient experience, as well as those of their advocates and caregivers, so that better treatments can be developed and delivered. The OBI team and our collaborators have worked very hard to put people first, and we hope that tonight's talk demonstrates our ongoing efforts. So now, without further ado, I'd like to hand things over to our panel, which will be expertly moderated by Mary Secco, who's the co-creator of the Clinic to Community Health Care Linkage Program and the chair of the Global Outreach at the International Bureau for Epilepsy. Mary, thanks for joining us, and over to you.
So thank you, Tom. Hello, everyone. My name is Mary Secco, and I will be your moderator this evening. Welcome to Dimensions of Care, the second OBI Public Talk in the Your Brain Health series. We are glad that you've been able to join us this evening. We do have about 45 to 50 minutes to chat live with our panelists, so we will take as many questions as we can in the time that we have. To send us your questions, you can use the chat function on the right side of your screen. You can DM our Twitter account at Ontario Brain, or you can email us at communications@braininstitute.ca. Let me begin by introducing our panelists. Denis Boileau is the Executive Director of Vista Centre Brain Injury Services, an organization supporting people whose lives have been affected by acquired brain injury. Dr. Fatimah Jackson-Best is an assistant professor at McMaster University and project manager for the Black Health Alliance. The Black Health Alliance seeks to improve access to mental health and addiction services for Black children, youth, and their families. And Katelynn Thibert. Katelynn is the president of the board of directors for Epilepsy Southwestern Ontario and a probation parole officer. She is an advocate for her eldest son who lives with epilepsy. Before hearing from our panelists, we're going to hear from a person with lived experience through a video interview. So let me introduce you to Megan Ball-Rigdon. Megan is a health and equity activist with a background in patient advocacy, medical administration, and policy development. Megan is the primary caregiver to her 2 children with severe autism, seizures, and communications difficulties.
Hi, I'm Megan Ball-Rigdon. I'm a mother and activist from Windsor, Ontario. It's an interesting story. I often call myself an accidental advocate. Both of my children, now 6 and 8, have autism and are on the moderate to severe end of the spectrum. We've overcome a lot of communication difficulties and some really big hurdles for them as developing kids. And when they were first diagnosed, the reason I call myself the accidental advocate, I didn't have any fear. So it was a daunting diagnosis, but I knew there was treatment and care available. And then about a short year later, everything changed and got upended. And when that happened, I had to move. I had to speak up because we knew that there were evidence-based therapies that could work, and it looked like a lot of us weren't going to have access to them. And given that they were out there and there were trained professionals to provide them, we knew that wasn't right. Well, that's, I guess, part of the problem that we've had with the system that has been developed. There are a lot of different therapies that can help kids with autism, speech language, obviously for communication issues, occupational therapy for motor skills, but really for a lot of kids, especially on the more severe side, applied behavioral analysis is just groundbreaking in what I've seen it do and what it's taught me to be able to do with my own kids. And doing it all alone is quite difficult, which is really the trajectory that we've been put on. Right now, for a lot of kids with autism, if you aren't me, if you haven't been through the parent training and all of that, you don't know. We need a system in place to help families walk through this because there is just too much, even if you are highly knowledgeable in the field. And so, yeah, right now this summer, I've been a therapist mom, and it takes a lot out. To know where to go, I had the ministry, I had her doctor, I had a clinical child psychologist who I found just by scouring stuff that I had received from Autism Speaks and Autism Ontario. Just literally just making every phone call, like a parent would when you feel like you're just a lost adrift. And then, like a program like Special Services at Home, which is a financial support, which takes a lot of stress off of parents when it comes to having physical things for your kids around the house to help them develop. Because right now, essentially, we're giving parents a whole other full-time job. Like, you're not just a therapist, but you're like a program coordinator. And I know there are professional ones out there and they're doing great work, but it's like when you put it on families too, it's too much. And it leads to a lot of us having breakdowns and then needing mental health services, more things that affect the brain. And it really is, if we could just support these kids from the ground up, it would make a huge difference. Well, certainly I'm only, speaking to my situation and what has worked really well for us. But I think having these centers, places like here in Windsor, we have the John McGivney Children's Center, obviously in London, and here we have Thames Valley doing services as well. These types of groups already exist. And I personally have watched my children learn to play and speak and read with the help of the people who work in these centers, both highly educated people as well as the instructor therapists who are just coming up on their own. And if we could just set up these centers to have more people in them, and especially coming out of COVID now where we're getting a little bit more flexibility and we can put groups together, it certainly has a lot of potential, I think. If we just used what's already there, it wouldn't take a whole lot of what's the word I'm looking for? Infrastructure building. So we should think about how a little investment now can be huge payoffs for everybody down the road.
Wow, thank you so much, Megan, for sharing your story, for sharing pictures of your beautiful children. We are grateful. I would like now to move to our panelists that are here with us today, beginning with Katelynn. So Katelynn, can you please share with us why you have come to be such a strong advocate for people with epilepsy?
Sure. I have 2 beautiful boys. My oldest, Dexon, will be 6 in November. My youngest, Duke's 4. When Dexon was just shy of 19 months old, he began exhibiting some symptoms that were concerning medically. So we took Dexon to our family physician. He told us essentially kids do weird things, and it could be neurological, it could be behavioral, and he referred us to a pediatric neurologist in Windsor. That was in the summer. She was off for the summer. We had to wait 7 weeks to get in for our first appointment. In the meantime, I wasn't sure what was going on with Dexon. He was exhibiting eye rolling, shoulder shrugs, falling, and I was hoping that it was a behavioral tic at that point. We met with a neurologist in September of 2018. She rushed us to the hospital for an EEG, confirmed a diagnosis of epilepsy, called back an hour later and changed a course of medication. Within the next month, she told us that Dexon's epilepsy was not something that could be controlled in Windsor, and he would have to be referred to London for a more specialty program. Unfortunately, that was a 6-month wait to get into London. In the meantime, Dexon's seizures, now confirmed that they were seizures, were occurring approximately 50 to 100 times per day, causing injury, regression, and just taking a toll on our family. So we decided at that point, after trialing through medication and playing the waiting game and working the OHIP system, it wasn't working for us. And so as a mom, to give Dexon a voice that he didn't have at the time, we reached out to the United States. We took Dexon to Detroit. The wait time was 10 days. We paid out of pocket for a consultation. The tests that we needed to diagnose the type of epilepsy that Dexon had in Canada were 6 to 9 month waits for the testing. We waited another week in Detroit. We paid out of pocket for a 23-hour EEG. That resulted in an official diagnosis of infantile spasms with the hips arrhythmia pattern on the EEG. It's considered catastrophic. It's considered a medical emergency, and waiting days, weeks, months was catastrophic to Dexon's development. So advocacy is my background. I have a master's degree in social work, so I knew how to drive the car. It was just a matter of knowing where to go. And so I'm a proud advocate for my son, and that's the reason why I'm so involved in the epilepsy world.
Again, thank you. Two impressive moms speaking about their kids. Thank you so much. Next, we'd like to ask you, Fatimah, to talk about the Black Health Alliance. We understand it was created over 20 years ago to address the gaps that exist in providing care to Black communities. Could you please tell us more about the work you are doing and the tools you are developing to help Black children and youth to navigate the mental health system?
Absolutely. Thank you, Mary. So you're absolutely correct. The Black Health Alliance was created over 20 years ago. It's an organization that does a lot of advocacy, research, policy work for issues that are specific to Black communities, which include obviously healthcare, health policy. I have been working on a project called Pathways to Care, which you introduced earlier. It is a project that seeks to improve access to mental health and addiction supports and services for Black children, youth, and their families. We've created several tools that we are very hopeful are helping Black youth and also their families, caregivers, service providers navigate the mental health system. Those include a interactive map, which you can go onto our website at www.pathwaystocare.ca. The map is actually only specific to several regions in Ontario, so Toronto, Hamilton, Kitchener-Waterloo, London, Windsor, and Ottawa. That map allows you to see what services are near to you, and in certain cases, like in Toronto, we're able to show you where public transit is so that you can know how you can get to those healthcare services, those mental health care services. And currently we are in the process of developing several tools, which include a treatment protocol and a practice framework that will be useful for both Black and non-Black organizations that serve Black children and youth and their families dealing with mental health and addictions issues. Those tools will essentially help organizations to better serve and better acknowledge the specific needs of Black communities.
Thank you so much, Fatimah, for sharing that. Now we'll ask Denis. Denis, could you tell us more about the role of the systems navigator in supporting people who have been impacted by an acquired brain injury?
Yeah, thank you, Mary, and good evening to everybody. So the systems navigator's role is really, we have a very complex system to deal with. And if you have a brain injury, or you are an advocate for someone with a brain injury, it's where do you start, where do you go? And it's a very complex system. So the role of the system navigator can be summed up in 2 words. One is connections, and the other one is access. So what do I mean by that? So in terms of access, the systems navigator will look at your state of your brain injury, the conditions, et cetera, et cetera, et cetera. And afterwards, the person or she will recommend the recommended best service for you in the state that you are in. Or it could be, for example, like it could be that you need supportive housing. It could be that you need independent living skills to be taught to you, et cetera, et cetera, et cetera. But the main role of the systems navigator is really to connect and to access. And she should be the first person that you get in contact with in order to be able to navigate the system and to get the proper services for yourself.
Terrific. Thank you. What a great answer as well. So we'd like to remind people to please send us your questions. You can direct message your questions to @OntarioBrain or send an email to communications@braininstitute.ca. So let's take an audience question. I see here we have one. How can community care and medical care be better integrated? And I'll ask, based on who I see first on the screen, Fatimah, how could we better integrate community care and medical care?
The question is, how can we better integrate community care and medical care? Well, I think that a lot of medical care needs to be initiated from a community-based perspective, right? And I think that we've seen situations where that is possible and where it's been really effective and successful. Some of the CHCs, the community health centers in Ontario, for example, one that I can think of about off the top of my head, Taibu Community Health Center in Scarborough. It is a health center that you can go to, look at the management of your diabetes, but they also offer, exercise classes that uses Caribbean music to get people, excited about working out. And the reason that they do that is because they know that the community that they're in is populated by many Caribbean descendant and Caribbean people. And so I think that, it's a logical next step if medical centers and medical care are embedded in community physically, but it really takes that extra step to embed yourself culturally and socially and become one with the communities that you're in, so that people feel safe and people feel safe coming to the service, right? And so I think that it really takes a concerted effort for medical services to decide, we're going to be doing things from a community standpoint. We're going to be embedded in community in a real way for them to launch from that point.
Thank you. And I'm going to ask this question to you as well, Katelynn, as the president of the board of directors of a not-for-profit organization. How can we raise the profile of not-for-profit organizations so that they're more of a coordinated part of the care we provide to people with brain health conditions?
Yeah, so communication is key. Approaching the community and medical care as a team through a team lens is such a critical piece of the whole puzzle. The wonderful thing with Epilepsy Southwestern Ontario, the agency that I represent, they're already doing this. They are in the hospitals. They are in neurology departments. They are providing information to families diagnosed with epilepsy immediately, providing education and support immediately, catching us before we hit the ground. It's such an important agency, and I think that other agencies in different communities can learn from that approach, because when you feel supported in a difficult journey, you're better able to access the more difficult parts of the journey with that support. So Epilepsy Southwestern Ontario is a prime example of how you can connect community to the medical world seamlessly. The only other thing we could ask is just for additional funding that would help support increasing that agency offering that we have.
Terrific. No, I hear you. And I'm going to ask Denis the next question. We often hear this comment about funding, and we hear about the gaps in the system. And if only we had more resources, we could do so much more. If your organization had more resources, what would you do with it?
I'd buy lottery tickets so that I can have more money. No, I'm kidding. So if my organization were to have better funding or stable funding, whatever you wish to say, I think there's certain things that we could do at our agency, and I'll give you a practical example. So where we are at Vista Center Brain Injury Services, we have a residence with 5 beds and a second one now with 4 beds. But if you ask me what's the wait time in order to get into that residence, I would have to tell you that it's something like 20 years or so. So, you know, if you were to give me more funding, I think the number one issue that is really prevalent within the area that I'm in is really to provide, and I'm going to say the word, and I'm going to use the word housing services for people with an ABI. Because if you take a look at the region where I am in Champlain, it's as big as the country of France, if you wish. But if you look at that whole region, there's something like, 17 beds that are dedicated for people with an ABI. And if you consider that there may be 2,500 cases of ABI that occur every year within this region, and you look at 17 beds, well, that's not a lot of beds or an awful lot of housing for people with an ABI who require special services.
Thank you. So we would like to remind the audience to please send your questions. You can direct message your questions to @OntarioBrain or send an email to communications@braininstitute.ca. So we're going to move on to another area of questioning. So in my work to improve care, I often start by interviewing people who use the healthcare system and ask them to identify ways we can make it more responsive to their needs. I'd like to pose the same question or a similar question to each of the panelists. Beginning with you, Fatimah, how can mental health care for the people you support be enhanced?
So the most important thing that I tell people when they ask this question is that we have to recognize that the one-size-fits-all model that mental health care and healthcare is premised upon leaves a lot of people out. It assumes that we all are the same, that we are all the same gender, we are all the same sexuality, we're all the same color, and that the mental health care that we receive would basically reflect the sameness, right? But we know, just looking at this panel, that we're all incredibly different and that we have different needs. And so when it comes to mental health care, we have to recognize on the other side that when it comes to Black youth and Black children and the pathways that they have into mental health care, a lot of the times they're very negative. The most common pathways into mental health care are through hospitalization and the police. And so, both of those inroads into mental health care can have very lasting and damaging impacts on Black youth. We know, based on what we've seen in the past couple of years, but we know has been happening over the past several generations, that police and Black communities have a fraught relationship, and that the surveillance of Black communities can lead to the over surveillance of Black communities. And so that leads to more hospitalization, more mental health crisis calls, more calls to the police because families and communities may not know what to do. And so that can be a negative pathway into mental health care. And so can hospitalization, because a lot of that hospitalization comes through ambulatory care. So it's an emergency situation, which means that Black youth are not getting care until they're symptomatic enough to need that intervention. And so, we have to understand that the system responds and has responded and will continue to respond differently to us based on our background, based on our race, based on gender, sexuality, and our relationship to the world. So it's really important for us to know that the one-size-fits-all model is just not appropriate for every single person.
And that absolutely makes complete sense to me, and I'm sure the audience that's watching us today. And when you think of Indigenous youth and other cultural communities in Ontario, is there a consortium? Is there a group of individuals that is looking at culturally appropriate care in brain health?
So for mental health, are you asking me? Sorry, or
sorry. Add on to that. Yes, sorry, Fatimah. Yes, yeah.
I was just going to launch right into the response. I mean, I've been thinking about writing about culturally responsive, culturally specific mental health care since I was, in my master's program. And communities, that's just a kind of an indication, because I come from I'm very embedded in the community that I work with. I'm not the first, and I definitely am not the last. And so, there's been definitely different committees, different groups, whether they're affiliated with a particular mental health care institution or a community health center or a specific project that may be up and coming or just developing. There has absolutely been, there has always been feedback from communities when it's asked of us, and also when it's not asked of us, because we see firsthand what's going on in our communities. But the question always is, are those recommendations implemented into mental health care? And unfortunately, based on what we know, they are not always implemented. So there can be all the committees and the consortiums and groups that we want, but we also have to have willing partners from institutions and agencies and organizations that want to adopt those recommendations for culturally specific, culturally responsive care.
Thank you. Again, a great answer. Katelynn, I'm going to move on to you with a similar question. You shared in your first remarks that you had gone to the States and the wait lists for care for your son were enormous. So what would the healthcare system look like if it was designed in the most person-centered way possible for children and people with epilepsy?
Well, I can speak from a parent perspective, and that's where I will speak from. Something that I think is critical from the beginning is offering parent advocacy training and mentorship so that parents feel in control of an uncontrollable situation. If that could be offered from the beginning stages, that would help navigate that system in a more efficient way. Community agency supports with government funding, obviously those will help to support getting families through the medical journey, but supported at the same time. Of course, they already exist, but there's always ways to improve those different agencies and to try and break down the silos between the agencies so that we're all working together as a team. Enticement for Canadian specialists to build our own communities. There's 5 pediatric epileptologists in Canada. So Dexon's is in London, which, I mean, luckily we don't have to get on a plane to go meet with her, but that's something that, some form of enticement to keep our remarkable doctors here local, our specialists here, is important to my family. Accountability and advocacy, huge pillars that are required to make our medical system run smoothly. Doctor accessibility and humanizing that team, feeling like you're able to connect with your doctor on a personal level and not just a medical level is something that's critical to build trust and rapport. Otherwise, educations like these public talks, getting our stories out there, having people hear them, having the right people hear them, and just building on education so that we can move forward instead of staying in this idea realm. We want to be moving into an action realm.
Thank you. Denis, if you could make one single recommendation to enhance care, sorry to make it one, we'll maybe have time for 2, but what would it be?
Well, Mary, I'll probably start by this, but I'll probably make a few recommendations or a few suggestions. And I think it's important to really emphasize, and this has been said within this presentation, but I am an advocate for people with a brain injury. And as had been said in this presentation, in Ontario, 1/3 of us are actually implicated or impacted by brain injury. So the first thing is, for the governments to realize that whenever you have a brain injury, and when we're talking about a brain injury, it's a very complex case. It's not easy. Is your brain injury at the front, at the back, and the side? There are many considerations to take, and there's not only the consideration of the physical aspect of the brain injury, but there's also, and I'm going to use the word, the psychological and everything else that goes with that. Plus, many of the people that do have a brain injury, they also have mental health issues and an addiction. So here I go with kind of like a list for the government or for people who are listening. Number one is really invest in services. What do I mean by these services? Well, I've talked about the housing situation, and I've talked about where I am, that we have like 9 beds, but the wait list is 20 years to have a bed for someone who has an ABI. So the first thing is I'd really say, listen, we need more services, whether it's independent living, teaching skills, or housing, or anything of that nature, because those are the services that are required for people with an acquired brain injury. Number 2 is base funding for organizations. And I'm sure that if I look at the rest of the panelists, they're probably going to be shaking their heads and say, yes. Where I am in terms of an agency, we haven't had an increase on our base funding in like 15 years. And the cost of living keeps going up, but I don't have to tell you about that. So the perception of having more in terms of our base funding will also allow us to be able to retain our workers and to pay them a better salary per se. The next thing is, I'm going to say more interjection between the different ministries that exist so that there's a cohesive policy and direction in regards to people with an acquired brain injury. And I'm going to touch on 2 other ones really quickly. One is research in regards to what is the better path for someone that has a brain injury, but what is the better path for someone in terms of services that have a brain injury? Because as I say, it's not one size fits all. They are all individual, and we have to treat them as that. And the last one is, I'm going to say, educational sessions such as we have like this, but also to educate the public in regards to the prevalence of brain injury within our community and the needs that inquires with that throughout the community.
That is a great list. And yes, my head was nodding when you talked about base funding, and I'm sure the other ones were too. We have some questions from our audience. So I'll begin with the first one. And it's something that Megan alluded to. She said, I felt compelled to speak up. So what can we as citizens or as people who live in the province of Ontario do to advocate for this change? Does anybody want to take that one? Fatimah, what can we do? How can we get this changed? Yeah.
So I absolutely believe in the power of groups of people. I mean, Katelynn, I'm so moved by the story of your sons and now the work that you're doing with the organization that you're representing. And I can just imagine how it feels going from, being alone with this challenge to now having organizational support and the resources and knowledge that you can gain through an organization. There's nothing like coming together as individuals to build a collective. And so I think that when it comes to mental health, we need to do that on the grandest scale. And one example of people's voices, I think, creating change is right here in Toronto. Over the last several years, we've heard numerous stories of police intervention when it came to members of our communities having mental health crises. And several times that interaction has led to the death of individuals, and it has led to a collective, uprising about police brutality and the need for the first responders to a mental health crisis to not be the police, because simply they're not trained for that, right? And so as a result in Toronto, and as a result of the constant voice of people and the collective push and the collective activism of individuals, we now are seeing this pilot program from the City of Toronto and several different mental health organizations that are going to be coming together to be the crisis response in mental health crisis situations. And that that can only be possible because we as a community saw what was happening across gender, across race, to people who simply needed good mental health intervention, but ended up dead, right? And so, I cannot speak enough to or really reiterate the need for us to come together and find like-minded people and group up or join organizations or get together with your families and your friends. And if it's important to you, create ways so that you can voice that importance and create some sort of change. And remember that change doesn't need to be massive, right? It doesn't always need to be the city and an organization coming together to do crisis response. Change can be, public knowledge. Change can be, creating supports in our own communities, in our own families. And so I think that we also need to be a little bit more generous with the scale of change when it comes to collective, getting together as a collective and trying to affect change.
Thank you. Now, to Katelynn and to Denis, does stigma play a role, or is it a barrier for people accessing services or care for the conditions that you support? Katelynn.
Okay, sorry, I wasn't sure on you first. With my experience, the stigma that my son is experiencing at this point in his life cycle, he's entering grade 1. Because of the nature of West syndrome or infantile spasms, the seizures themselves caused damage to his brain, caused regression. So we're now entering that scary world of academia where is his brain injury stigmatizing his ability to progress academically. And so now my advocacy hat is changing from, medical mom to now teacher mom, and what we need to move forward is an independent education plan. And it's starting to learn a whole new set of tools to make sure that Dexon's needs are met despite what's happened to him. And it needs to be viewed in a strength-based perspective. Dexon has so many remarkable strengths that we need to be able to build on in the school setting. And that is reflective in our medical journey too. We need to really focus on a strengths perspective and a unique individual perspective. Dexon is his own person with his own experience, and we need to be cognizant of that, and we need to act on that.
Very good. Denis, did you want to answer that question, or do you want a brand new one?
Oh, no, let's go with this one. Definitely, yes, we do know that stigma certainly exists in the world of acquired brain injury because of the behaviors that they have. And just again, to be practical in a sense, so in the city of Ottawa, where we are located, there's about 30%, if not more, of the people that are homeless that have an acquired brain injury. And they do suffer the stigma, and not to point, anyone in particular, but if I take the shelters, they would like to go and live in the shelters or be in the shelters, but because of their behavior, their strange behavior that people will say, well, they really don't stay there for very long. They may be a week and then, they move on to another shelter or they're kicked out or anything of that nature. So yes, there is an awful lot of stigma associated with an acquired brain injury. And I think, one of the ways to combat that is really in terms of education and to make people aware, well, and I'm going to, it's an invisible disability that people have, but we don't really see it because many of them will look just like you or I, but yet they will act strangely. And most of that also comes because they do have mental health issues and addictions. So stigma is there. Dealing with the stigma is difficult, but I believe the key word here is education.
Thank you. So I'd like to ask both Fatimah and Denis, how do people generally find you to access your services? So Fatimah, how do they find Black Health Alliance?
So you can visit, you can visit Black Health Alliance at the website, www.blackhealthalliance.ca. And if you wanted to know more about the tools and the products that we've developed for Pathways to Care, you can check out www.pathwaystocare.ca. And on our homepage, we have that map. We also have a newer tool called Connect Me, and it basically is it uses filters to allow the seeker to decide what is most important to them for a mental health care service. So if you need a French-speaking organization, you can use that filter. If you need a mental health from an organization that will accept private insurance, or if you need free services, you can use that as a filter. So that's called Connect Me. It's also on the same homepage of www.pathwaystocare.ca. But importantly, we don't offer direct service provision. We are specifically designed to improve access to those services that already exist for Black children, youth, and their families with regard to mental health and addiction supports.
Very good. Denis, help us to know how people would find your services.
Well, I think the best way to answer that is really to throw the ball back at the systems navigator that we have in Champlain, because she is the first point of contact that should be for people with unacquired brain injury, and she would be the ones who would recommend the best service that you actually need. But having said that, I think also, you can go to our website, vistacenter.ca. But just to give you a practical example of how people find us, and I'm going to talk about an initiative that was started about 4 years ago with the rehab center that we have here. So someone who has a brain injury, the trajectory is usually, the hospital, the rehab center, and then the community at large in order to find services. Well, about 4 years ago, we created this partnership with the rehab center, or the Robin Easy Center in my area, whereby someone who is at the rehab, they're actually seen by a worker from the Robin Easy Center and a worker from Vista Center, and they both work together in order to make the best path possible for that individual, but also not only the best path, but also to decrease their time that they're actually spending in the rehab center, so that the turnaround from the rehab center to community-based service is much quicker, much faster, but also it's a better service because we can cater to the needs of the person that is within this transitional program that we have with the rehab center.
Thank you. Katelynn, I'll ask you a similar question. What entry points to the healthcare system did you find the most helpful when accessing services for your son?
None of them were helpful. None of them were obvious. None of them were clear-cut. I did the digging, and that is the first and foremost problem with our healthcare system, at least in Ontario. One thing I can speak to as far as a positive in our healthcare with epilepsy specifically, once I was finally able to access London and London's epilepsy community at the hospital, there is a comprehensive epilepsy clinic that Dexon is involved with. So they've figured out how to eliminate those silos that I spoke of, those shadows. And then in one community setting, Dexon has access. During one appointment, he was able to see an EEG technologist, Epilepsy Southwestern Ontario representatives, nurses, social workers, researchers, specialists, residents. So when we finally were able to work to get to London and work hard to get to London through advocacy, when we finally arrived, we were at least embraced in a comprehensive epilepsy community clinic setting. And so I think that other agencies would do well to look at that point of access and to see how you can have everyone come together. And I guess other people probably have experienced this with medical appointments. You go to this appointment and then you go to that, and they're not connected and you don't have support. So with the comprehensive epilepsy clinic, everyone is on the same page. Everyone is aware of what's going on with Dexon, and everyone is working together for what our goals are and our next steps are.
Thanks. It's somewhat disappointing because we've put together the Clinic to Community in your region, which was a referral-based program from a healthcare provider. And obviously it didn't make the linkage that we wanted for you and your family. Yeah.
When during our first appointment with our neurologist, we were told about the Clinic to Community in our first appointment, which is wonderful. Administratively, what didn't happen, that referral form did not make it from the neurologist's office to Epilepsy Southwestern Ontario. So if I didn't advocate knowing that that was an option for me, Dexon would have fallen through the cracks. I knew during that appointment that somebody said, oh, there's this Clinic to Community, this support agency out there for you. I remembered that I signed a release of information. A month later, I thought, I haven't heard anything. What's going on? How do I get support? This diagnosis is difficult. I'm in crisis. What do I do? So I connected with Clinic to Community because an administrative error was made on the very first day.
Oh, okay. Thank you for sharing that. So we have a nice question from the audience. It says a crucial facet of care is offering support for caregivers. On this subject, we have a question from the audience about how to support teens looking for help. So Fatimah, how might an organization like Pathways to Care help both the person needing support as well as work with their caregivers to be able to cope?
So, I mean, I think that one of the most distinctive parts about Pathways to Care that attracted me to the project when I came on as the manager in 2018 was that it's not just for Black children and youth. The tagline is literally Black children, youth, and families. And so it recognizes that families are an incredibly pivotal, critical part of, recovery, of living with mental illness, of dealing with mental health challenges and crises. And so while the services that we are mainly connecting people to maybe youth focused and youth oriented, there are also many different organizations that provide mental health supports to family members, whether they're parents, guardians, family members, whatever it might be, service providers even. And so, it's really critical that we understand that youth specifically, and all people, we don't live in isolation, right? We're connected to other people, whether they're friends, family, chosen family, biological family. And so when people are in crisis, whether it's mental health crisis or if they're going through some substance use crisis, the people around them are the ones who are the first usually point of support and point of contact for people who are dealing with these challenges. And so those people absolutely need that help. And a lot of the services that are in Connect Me and that you'll find on our map, they'll be for youth, but then there'll also be services that are available at the organizations that are for people who are adjacent to youth or supporting youth.
So Denis, we have a question from the audience about your services. Do you offer support for caregivers?
We do not particularly ourselves offer that kind of service, but we do have our sister organization that actually do offer services of that nature. We are certainly looking into or projecting that, with increase in funding, we could probably have a service like that and to create groups where people could come together and talk about the different aspects of caregiving, but also the challenges, the difficulties, but also how to help one another. So I'm going to repeat that we do not have a caregiver group per se, but that is simply because of a lack of funding to give out a service such as that.
Completely understandable, and it leads into a question that we also received from the audience. It said everyone looks to the government for support, but what about the private sector? What role do they have in helping us to have better brain health? Who would like to take that one? Does the private sector have a role? Denis, you.
I think that's a great question. I really don't have an answer to it. I would love to see the private sector to be able to link up with them to provide better services or other services that we don't necessarily have. But I think that's a very difficult situation, especially when you're talking with someone that has a brain injury. That if you're talking that someone that has a brain injury, it's not something that's going to be, and I'm going to say, 6 months, a year, 6 years, you do not really know. You could have the same client for the next 20 years or so. So I really don't know how to answer that question. Certainly, I would welcome anybody who'd like to partner with us in order to develop new services. But I think it's a very complex question to answer.
Fair enough. And I'll follow it up with you, Fatimah, mostly because I think one of the areas that had a lot of investment was mental health. So often people talk about silos in the healthcare system. Has this been a challenge to you working in the mental health care system, silos, and what could we do about that?
Yes, silos are across an issue across, the health landscape. Mental health is absolutely not it's not immune from the silo issue. I hear a lot of practitioners, especially in the research that we collected in 2020 to 2021. We did a survey across various, all across the province and those 6 cities that I outlined, regions that I outlined rather. And one of the issues that people talked about considerably, both in the survey and then in the follow-up focus groups that we did, was that organizations tend to work with one another, right? And the organizations that are working with one another are typically organizations that are mainstream organizations. So there's not enough mainstream organizations who are partnering with Black community organizations, even if they're seeing a lot of Black youth. Every organization has their own methodology and the way that they do things, and they may think that they have all the answers. But a Black organization that may not be a mental health care organization, but that has the trust already of Black community members and has specific ways to, administer culturally responsive care, mainstream organizations can absolutely learn from that. So in that case, a silo can be very, very detrimental to the person who's receiving the care, which are Black children and youth. And so, we advocate all the time for people developing partnerships, and not just partnerships that are, symbolic or tokenistic or opportunistic, but ones that actually really allow people to show and maximize and showcase the best of their organizations, and to support organizations that may not have the same kinds of resources, may not have the same kinds of connections. So, silos don't help anyone. They actually further harm people who need the help the most. And it's not, this is also the issue that exists in mental health care.
I completely understand. And I appreciate your informed opinion and sharing that with us. Now, we're going to go to the last word, and we're going to ask each of our panelists, what would you like the audience to take away from this conversation? So beginning with you, Katelynn, what's the take-home message? What is the most important thing you want people to hear from your participation today?
I think that just education, that's the spark that starts the flame. You don't know what you don't know. And, as cliche as that is, it is so true. 1 in 100 people have epilepsy. 1 in 10 people will have a seizure in their lifetime, whether it's in the healthcare system or in the private system. Epilepsy impacts Ontario and impacts the world, and it's invisible, like Denis had mentioned. So the more that we educate correctly, the less we complain, the more we do, the more that we will progress together as communities, as provinces, as a country. So again, I'm so honored to be a part of this panel so that I can put a little piece of education out there and hope that that spark reverberates and gets into the right ears and helps progress that action.
And moderator's privilege here, if we had private sector and if we worked together to reduce the burden on people with these brain health conditions. And I'm most familiar with epilepsy, where our unemployment rate for adults is 50%. And I think, and kids struggle in school. And I think if we had a brain health strategy for this province where we were all working together to be culturally responsive, to look at the voices of caregivers who are caring for, I would imagine, Denis, your community, because the person with the brain condition is often very reliant on their family. I think we touched upon that a little bit, but I'm not sure that we've been able to get our message about the importance of brain health out provincially as well as we'd like to. And maybe that's something we should be thinking about after this conversation today. But I said it was your last word, not mine. So Fatimah, what's your last word? What would you like the audience to take away from this conversation?
I really like the question that was posed about, I don't remember what the question was about, but I remember my response was about collectivity and people coming together. And I think that just in the spirit of Katelynn's response of everyone becoming educated, I think that maybe the next logical step is to find other like-minded people and to group up and to, realize that we're stronger together. We are more powerful together. We can be more influential together. We can be more persistent together. And so my final word would be, once you have a better idea about mental illness or brain injuries or epilepsy, and you want to do something about it, that, the next step is to become social about it and to reach out to other people who are like-minded so that you can start to have some action and start to address the issue.
And Katelynn, what do you, no, Denis, sorry, Denis. And you have 30 seconds to give us your final comment.
Final comment is, or messages to take away is that 1/3 of people in Ontario are impacted by an acquired brain injury. It is very complex cases that we are dealing with, and that the government has to realize that one size fits all does not fit for everybody. So, I will advocate for us as agencies to create partnerships with one another, but also for government to realize that we also need to inject more dollars within the services that people with an acquired brain injury require.
Fair enough, and well said. So it is my pleasure to thank the three of you. Your dedication, your expertise, your passion. You are three natural advocates, and we are lucky that you are working in the field of brain health. And I also want to comment again about Megan, because when you have a child with two children with severe autism and you're volunteering to make a better world for others, you got to really think that's amazing. And that's to you too as well, Katelynn. So we have some resources to share, but before I do that, I'd like to, on behalf of the Ontario Brain Institute, I would like to thank you, the audience, for posing questions and joining us today. We have some resources to share with you for more information around this topic. So we will post them on the screen shortly, and a complete list is also available on the OBI website. Your feedback is important to us. We have a survey link in the chat box. Please share your thoughts with us about tonight's talk. OBI Public Talks are designed to share the latest knowledge on brain health and to offer simple tips to manage both health and wellness. OBI's current set of public talks, as you know, is called Brain Health. This series explores topics suggested by you, the audience. So please fill out your survey. Stay tuned. Women's brain health will be later this fall and precision medicine in the spring. So to sign up for the next talk, you will find a link in the chat box or on the OBI website. So it's 6:30. I want to thank you for coming and thank our panelists and the OBI for offering this informative session. Enjoy your evening.